So yeah, if someone has, I did get COVID, and I was down for a couple of weeks on that one, and I just took it every day, and then I continued to take it for, another couple of months afterward, just because I was just getting myself back on track, and it was a pretty hardcore experience.
Okay, thank you. And what would each of you say to someone that says, I feel depressed and I've been advised to go on an antidepressant? Does the natural world have an answer for depression as opposed to taking antidepressants? And let's expand that to also include antipsychotics. So the antidepressants and antipsychotics, is there an alternative that you're aware of in the natural world?
Dr. Murray.
Well, I'm not a big fan of conventional antidepressants. If we look at the brain and how critical it is to give it the tools it needs to be healthy, it doesn't make any sense that we would even try to treat depression with any single agent, natural or prescription. That said, there's some fundamental building blocks for brain health that we just can't ignore. A deficiency of any single nutrient can lead to altered brain function, particularly things like the omega-3 fatty acids. And there have been great studies, large double-blind placebo-controlled studies in all sorts of mental health issues showing that doses of omega-3 fatty acids, fish oils, can be very helpful in improving these conditions. And often we don't use them as first-line therapy, but they did a study in college-age females, and it was really provocative because suicide ideations are very common in the first few years of college. And in this study, they took women that were very depressed, suicidal, but had not been on any conventional medication. And in the double-blind study, every one of those women that were taking the fish oils within 2 weeks had complete resolution of their suicidal ideations and depression. And I just think that it's just a better approach. There's a lot of natural antidepressants, but they've done studies as well, just cleaning up the diet, getting people off of sugar, and getting them a more nutritious diet can lead them to feeling better. And it's not if we look at a classic antidepressant drug, they generally take 2 weeks to show an effect. They've done studies in adolescents where they've had them eat a serving of blueberries, and the blueberries provided immediate benefit. In terms of herbs that have antidepressant activity, St. John's wort extract was shown in numerous studies to be more effective than Prozac and Zoloft and other antidepressant drugs. More recently, we have saffron. Saffron extract has shown very good antidepressant activities. And there's a whole shift in the notion of what causes depression or what leads to depression. And there's a focus now on using anti-inflammatory herbs, things like curcumin, and curcumin has shown very good effects in improving mood. But when I look at, the last few years I was in practice, I was seeing mainly people for depression because I'd gotten really good at helping these people. And I'd written books and natural alternatives to Prozac. I wrote a book on 5-HTP, and people would come and they would expect me to give them a magic natural product to relieve their depression, which I did. But I also found that for most people, what I think really helped them was getting them engaged in life. And what happens when people are depressed, they lose the affinity for in enjoying life and engaging in activities that help them feel good about living. So some of my simple prescriptions, in addition to natural products, would be to find out a little bit about what makes them happy and what makes them tick. It'd be interesting. I remember this one time I asked this guy what he really enjoyed in life, and I'd never had anybody that was depressed respond like he did. He started rattling off, because I like to go for walks, I like to bowl, I like to go to movies, I like to have nice dinners, and he just starts rattling off, just going down a long list, and I'm thinking, wow, no patient's ever gone on like this. So I said, well, how long have when's the last time you've done any of those? And he said, it's been months. And I say, well, how long have you been depressed? And he says, it's been months. And I said, do you think there might be any correlation? And, we think so often that people lose the enjoyment of things that they used to enjoy, but a lot of times it's just they just stop doing them. So anyway, there's a lot of things we can do to help people with depression, but I like to start with the foundations and making sure everybody has the building blocks for health: positive mental attitude, health promoting diet, and health promoting lifestyle. One of the quickest ways to boost mood is helping people improve their sleep. Poor sleep quality leads to poor energy, depressed mood. So I spent a lot of time working with patients and helping them get a better night's sleep. And it's amazing how much better the world looks, how much brighter their mood is after a good night's sleep.
Okay. What about for people that are taking cholesterol-lowering medicine, statin drugs? When they come to you and they say, I was told to take statin drugs, I'm not going to change my diet, I'm not going to exercise, so my doctor said I should take statin-lowering drugs. Would you say great? Would you say don't do anything? Would you say take red yeast rice or some alternative? What would you say to that person?
Dr. Murray,
well, I don't see any difference between red yeast rice and a low dose statin. There's really not much different. And that's one area where people they're kind of scared into taking something, and if they're taking a statin, one thing that can be done to kind of reduce the risk for some of the side effects is making sure they're getting enough coenzyme Q10. 200 to 300 milligrams per day of CoQ10 can help reduce the risk of some of the side effects of statin drugs. I just don't think there's a need for statin drugs for most people. There's a lot of times in medicine we fall victim to conventional wisdom, and conventional wisdom is sometimes based on convenience and not based upon facts. There's no question that statins have been shown to improve cardiovascular mortality and cardiovascular events in men. It's less proven and it's debatable whether it has that effect in women. We also are treating way too many people with statins. The people that benefit from statins are probably 20% of the people that are taking statins. So this is an overprescribed medicine, and it's largely due to the marketing efforts of this is a big business, a multi-billion-dollar drug category. There's so many things that can be done. Head-to-head comparison studies have shown, for example, a number of compounds can help lower cholesterol. There's the portfolio diet where they've had people follow diets full of all sorts of different cholesterol lowering agents, and that works just as well as a statin for most people. Berberine, which is a compound from golden seal and barberry, has been the subject of over 27 double-blind placebo-controlled studies. In these studies, it's been shown to lower cholesterol levels as efficiently as statins. It also lowers triglyceride levels, and it's been shown to lower glucose levels as well as metformin in patients that have type 2 diabetes, and it also helps people lose weight and lower blood pressure. If berberine was a drug, it would be the biggest selling drug in the history of the world because it affects all of these areas. So yeah, there's a lot of alternatives out there that could be used. But the bottom line is that it's still debatable whether statins offer any significant benefit to women. And in men, 80% of the statin prescriptions are providing absolutely no benefit. So they would be better off going a natural route and really making a bigger impact on their health.
So is there anyone you recommend goes on a statin?
I think statins are really helpful in people that have a hereditary predisposition to early death due to cardiovascular disease. If people have excessive cholesterol levels, total cholesterol levels over 300, if their LDL levels are over 150. But this idea now that we should have anyone taking a statin if their LDL levels are above 100 is absolutely ridiculous. It's just they're not going to provide any benefit in extending life. In the studies with statins, the benefits, the numbers needed to treat are huge to see any significant benefits, and you're much more likely to, for most people that are taking statins, you're much more likely to die of something else than die of a heart attack anyway. So I think there's better things to be focused on in extending life and improving cardiovascular health.
Thank you. What do you tell people that are dealing with constipation? What's the best approach?
Well, constipation is it's hard to imagine that it's such a problem. It is a real problem for a lot of people. There's so many just basic things, making sure you're well hydrated, making sure you're eating enough dietary fiber. A lot of times people hear dietary fiber and think, oh, I need to eat more whole wheat bread or eat bran muffins, or eat cereal. No, fiber is a plant material that we don't digest. And so all plant foods have fiber, and some of the best fibers in helping people with constipation are the gel forming mucilaginous fibers that we get in fruit and in vegetables and also legumes. So, eating a high fiber diet is important. Having one or two prunes a day can be very helpful. Same thing, figs, dates have also been shown to have good laxative effects. Just some basic things like that go a long way. One of the problems is that people need a little bowel retraining if they've been on laxatives, particularly stimulant laxatives. More fiber is always a good place to begin with constipation. The biggest cause of constipation in children is milk. So getting them off milk is often curative of their constipation.
And what about herbs? What approach would you take with herbs or supplements?
Yeah, I mean, I agree with everything that Dr. Murray just said. And hydration is such a key. And I also think exercise, I think getting the body moving on a regular basis is really, really important. Some of my favorite herbs, and this is where I think you have to be really careful because you can get your body addicted to herbs that can help with constipation just as much as you can get used to a laxative, like a prescription or an over the counter. But things like Cape aloe and Cascara sagrada, I really love. Psyllium husk, and then bentonite clay. You can get, some of these colon cleanses that can actually help you with that. But you need to be careful because you don't want to get yourself used to taking these supplements so that you lose the function of what your colon does. But yeah, lifestyle, food, hydration, and all of those foods that Dr. Murray suggested, I could have said exactly the same thing.